The shuttle doors opened with a soft hiss, and Daehyun stepped into the largest medical facility he had ever seen. The Taravan Medical Institute stretched out before him like a crystal palace floating in space. Everything glowed with a soft blue light. Holographic screens floated in the air, showing pictures of different alien bodies and their organs. Robot arms moved silently through the halls carrying supplies and equipment. Daehyun had to stop for a moment just to take it all in. He was a doctor from Earth, trained in a small hospital in the mountains of South Korea. There, they had computers and modern tools, but they also learned the old ways. His teachers had made sure he knew how to stitch wounds by hand, how to feel a broken bone and set it right, how to listen to a patient's body with just his ears and hands. They said technology could fail, but knowledge never would. Now, standing in this place where aliens from 40 different worlds came to learn medicine, Daehyun felt very small. A floating drone approached him, scanning his identification badge with a beam of red light. Dr. Kang Daehyun, human physician from Earth. Welcome to Taravan Institute. Please follow the guide lights to Orientation Hall 7. The drone's voice was flat and emotionless. Small lights on the floor began to blink, creating a path for him to follow. Daehyun walked through the corridors, passing students of all shapes and sizes. Some had scales, some had fur, some seemed to be made of something like living crystal. They all wore the same white medical uniforms with colored badges showing their year of study. Many of them stared at Daehyun as he passed. Humans were still new to the Galactic Coalition, and human doctors even more rare. The orientation hall was a huge circular room with seats arranged in rising circles around a central stage. Daehyun found a spot near the back and sat down. Next to him, a young human woman was reviewing notes on a tablet. She looked up when he sat down and smiled. Another human. I'm Hyeon. Are you here for the exchange program too? She spoke in Korean, which made Daehyun relax a little. Yes, I'm Daehyun. I'm from Gangwon Province. And you? Seoul. I've been here for 2 months already. It's amazing, but also intimidating. The technology they use here is hundreds of years ahead of Earth. I feel like I'm learning medicine all over again from the beginning. Before Daehyun could respond, the lights dimmed. A figure walked onto the central stage and the room fell silent. She was tall and thin, with skin that looked like pale blue crystal. Light seemed to move through her body in slow waves. This was a Quilithan, one of the founding species of the Galactic Coalition. Good morning. I'm Instructor Velinar, head of surgical studies at this institute. Her voice was clear and strong. Today we will discuss the evolution of medical practice in the civilized galaxy. What you will learn here represents over 3,000 years of advancement beyond the primitive methods that many young species still use. A hologram appeared above the stage, showing an ancient operating room. Daehyun recognized it immediately. It looked almost exactly like the training rooms he had used on Earth. Metal tables, bright lights, trays of surgical instruments, scalpels, clamps, needles, and thread. This, Velinar said with clear disgust in her voice, is how medicine was practiced in the Dark Ages, cutting into flesh with metal blades, sewing tissue together with thread like repairing clothes, hoping and guessing instead of knowing. It was brutal, painful, and dangerous. The hologram changed, showing a sleek chamber filled with soft light. A patient floated inside, surrounded by thin beams of energy. This is a cellular regeneration chamber. It scans the body at the molecular level, identifies all damage, and repairs it perfectly. No cutting, no pain, no scars. The patient is healed in hours instead of weeks. This is real medicine. More images appeared. Nano-surgical robots that could work inside a single cell. Organ printers that could create a new heart in minutes. Molecular scanners that could detect disease before any symptoms appeared. Each one made the old methods look more and more outdated. Surgery, as primitive species understand it, has been completely obsolete for over 2 centuries. No civilized doctor needs to know how to cut or stitch. Those skills are as useless as knowing how to make fire by rubbing sticks together. Some of the alien students laughed at this. Velinar's eyes moved across the room and stopped on Daehyun and Hyeon. I understand we have some human visitors with us. Humans are newly admitted to the coalition, and their medical knowledge is still quite basic. Tell me, do human doctors still perform manual surgery? Daehyun felt dozens of alien eyes turn toward him. Hyeon looked down at her tablet, her face red. He stood up slowly. Yes, instructor. We do. Velinar nodded as if she had expected this answer. And do you know these primitive techniques yourself? I do. I was trained in both modern technology and traditional methods. How interesting. Tell me, Dr. Kang, why would anyone waste time learning obsolete skills? Her tone made it clear she thought it was foolish. Daehyun chose his words carefully. My teachers believed that understanding the basics makes us better at using advanced tools. They also said that technology can fail, but knowledge and skill do not. More laughter from the students. Velinar smiled, but it was not a kind smile. Technology can fail? Here at Terravon, we have 7 levels of backup systems. Equipment failure is impossible. Your teachers sound like they were very traditional, perhaps stuck in the past. Daehyun sat down, feeling heat in his face. Haewon whispered, "Don't worry about it. She's like this with everyone who isn't Quilithan." The presentation continued for another hour. Velinar showed more examples of advanced medical technology, each one more impressive than the last. Daehyun had to admit it was incredible. Diseases that would take months to treat on Earth could be cured in days here. Injuries that would leave permanent damage could be healed completely. It really did seem like magic. When the orientation ended, students began filing out of the hall. A Quilithan student, younger than Velinar but with the same crystalline appearance, stopped near Daehyun and Haewon. His badge said his name was Tovan. "I heard your conversation with Instructor Velinar," Tovan said. His voice was not unkind, but there was confidence in it that bordered on arrogance. "I don't mean to be rude, but manual surgery really is outdated. I've been studying here for 3 years and I've never needed to use anything but technology. Why learn to use a knife when a regeneration beam can do better work in half the time?" "I understand," Daehyun said quietly. "You may be right." Tovan seemed pleased by this answer. "Well, good luck here. I'm sure you'll learn a lot." He walked away with several other students, all of them talking excitedly about the new equipment they would get to use this semester. Haewon looked at Daehyun. "Do you really think he's right? That everything we learned on Earth is useless here?" Daehyun watched the students disappear down the corridor. "I think they've built something amazing here. But I also think my teachers were right about one thing. It's dangerous to forget the basics, to rely completely on tools and forget the knowledge behind them." "You sound like an old man," Haewon said, but she was smiling. "Maybe I am," Daehyun replied. "Come on, let's find our quarters. Tomorrow we start learning their way." They walked through the gleaming corridors together, 2 humans in a place designed for more advanced beings, carrying knowledge that everyone here considered worthless. Neither of them could know that in less than 24 hours, that knowledge would become the most valuable thing in the entire facility. The Institute hummed around them, confident in its technology, unaware of how fragile that confidence really was. The next morning started like any other day at the Institute. Daehyun attended lectures on alien physiology, learning about the different ways various species' bodies worked. Some had 2 hearts, some had no heart at all but used a different system to move fluids through their bodies. Some breathed oxygen like humans, others needed methane or even pure nitrogen. It was fascinating and overwhelming at the same time. In the afternoon, he had a practical session scheduled. Students were supposed to observe a demonstration of a cellular regeneration chamber. It was considered basic knowledge, something every first-year student needed to see. Daehyun arrived at Lab 7 along with about 20 other students, including Haewon and Tovan. The room was large and circular with a regeneration chamber in the center. It looked like a large glass tube filled with blue light. An instructor, a reptilian being with green scales, stood beside it. "Today you will see how we treat severe injuries," the instructor said. "I will simulate a deep tissue wound in this test subject." He gestured to what looked like a large piece of synthetic flesh in a container. "Watch carefully." The instructor made a deep cut in the synthetic flesh, then placed it in the regeneration chamber. The blue light intensified and students leaned forward to watch. Thin beams of energy began moving across the wound and slowly, the damaged tissue began to heal itself. It was incredible to watch. Then something went wrong. There was a sound like a small explosion somewhere far away. The floor shook slightly. The lights flickered once, twice, then changed to a dim red emergency lighting. The regeneration chamber's blue glow died instantly. "What was that?" someone asked. The instructor touched a panel on his wrist, listening to something in an earpiece. His expression changed from calm to concerned. "Everyone remain here. There's been an incident in the power distribution center. Nothing to worry about, just a minor malfunction." But more alarms began to sound. The instructor's earpiece buzzed again, and this time his face showed real worry. He spoke quickly in a language Daehyun didn't understand, then switched back to common Galactic. All non-essential personnel need to evacuate to the main halls. Medical staff and students follow emergency protocols. Go now, orderly, no running. Students began moving toward the exit, but then another sound cut through the air. This was different. Not an alarm, but a call for help. A communication device on the wall crackled to life. Medical emergency in Training Bay 4. Multiple casualties. We need immediate assistance. The voice on the other end was panicked. The instructor ran toward the door. You students, stay here. But several of the advanced students, including Tovan, followed him anyway. Daehyun looked at Hee-won, and without speaking, they both made the same decision. They were doctors. If people were hurt, they needed to help. They ran through the corridors following the instructor and the other students. Emergency lights cast everything in red shadows. They could hear shouting ahead, and the smell of burned metal filled the air. Training Bay 4 was a disaster. Part of the ceiling had collapsed. Broken equipment lay scattered across the floor, and in the middle of it all, 3 students lay injured. Daehyun's medical training took over immediately. He scanned the scene, identifying the injuries. One young man was trapped under a piece of debris, blood pooling around his leg. A young woman sat against a wall, holding her arm at an odd angle, her face white with shock. A Quilithan student lay on his side, his crystalline skin cracked, making strange whistling sounds as he breathed. Other medical staff arrived, including Instructor Velinar. She took control immediately, her voice sharp and commanding. Devan, scan the human male. Someone get stretchers. We need to transport them to the regeneration chambers immediately. Tovan pulled out a small scanning device and waved it over the trapped student. His face went pale. Instructor, the human's name is Benji. He has a severe laceration to his femoral region. I think the artery might be damaged. He's losing blood quickly. Then we move fast, Velinar said. She tapped her wrist device. Regeneration Chamber 3. Prepare for emergency patient. A voice came back through her device, and Daehyun could hear the fear in it. Instructor, regeneration chambers are offline. The power failure affected all primary medical systems. We're running on backup power, but it's only enough for life support and basic functions. Velinar froze for just a moment. Around her, the other medical staff began to panic quietly. How long until main power is restored? She demanded. Engineering says minimum 6 hours, possibly 12. 12 hours. Tovan looked down at Benji. He doesn't have 12 hours. Maybe not even 1 hour. Velinar's confidence crumbled. Daehyun had never seen someone look so lost. She was one of the most skilled doctors in the galaxy, but all her skill depended on machines that weren't working. We'll use the stasis pods. Put all 3 patients in stasis until the power comes back. Hee-won spoke up quietly. Instructor, the stasis pods need a lot of power too. The backup system can't run 3 pods at once. We checked during orientation. Velinar turned on her, angry at being contradicted. But then she checked her own device and her anger faded. The human student was right. They couldn't use the stasis pods. Then what do we do? Tovan asked. We can't just watch him die. There must be something. He pulled up information on his device, searching frantically. Manual surgery. It says here that before regeneration chambers, injuries were treated by direct physical intervention, but none of us know how to do that. It's not in our training. The injured woman, Mi-young, spoke through her pain. My arm is broken. I can feel the bone moving under the skin. Can't anyone help us? Daehyun stepped forward. His voice was calm, steady. I can help them. Everyone turned to look at him. Velinar's eyes narrowed. Dr. Kang, what do you mean? I can treat their injuries manually, the way doctors did before you had regeneration chambers. Velinar stared at him like he had suggested something insane. You want to perform primitive surgery? Cut into his leg? Sew the wound closed with thread? That's barbaric. Even if the artery is damaged, manual repair would be incredibly risky. The chances of infection, of improper healing, of permanent damage are better than the chance he has if we do nothing, Daehyun interrupted. I know it seems strange to you, but I've done this many times. I can stop the bleeding, repair the artery, and close the wound. For the woman with the broken arm, I can set the bone and immobilize it. For the Quilithan student, I'll need guidance on his physiology, but I can adapt. Benji groaned in pain, his face growing paler. Blood continued to spread across the floor. Time was running out. Velinar looked at her device, at the injured students, at Daehyun. She was trapped between her training that said this was wrong and the reality that there was no other option. "You're certain you can do this?" she asked. "Yes." "Then do it," she said. "But I'll be watching. If I think you're causing more harm than good, I'll stop you immediately." Daehyun nodded. "That's fair. I need basic surgical instruments. Scalpels, clamps, sutures, needle holders, clean water and antiseptic, and someone to assist me." Hyewon stepped forward without hesitation. "I'll help." Velinar gave orders rapidly, and staff began running to gather the supplies. Tovan looked down at his scanner, then at Daehyun with something like awe in his eyes. "You're really going to do this," he said softly. "You're going to operate with just your hands and some basic tools." "Yes," Daehyun said, already kneeling beside Benji and checking his pulse. "And you're all going to learn something today. You're going to learn that medicine isn't about the tools you use. It's about the knowledge you carry and the will to help no matter what." The supplies arrived and Daehyun began to prepare. Around him, alien medical students who had never seen surgery performed without machines gathered closer to watch. The real test was about to begin. Daehyun washed his hands thoroughly with the antiseptic solution, scrubbing between each finger just as he had been taught years ago. Around him, alien students watched in silence. Some looked curious, others looked horrified. To them, what he was about to do seemed impossible, even dangerous. The Institute staff had brought surgical instruments from what they called their historical medical collection. These were tools that had been used centuries ago, now kept only as museum pieces. Daehyun examined each one carefully. Scalpels sharp enough to cut cleanly, clamps to hold blood vessels, needle holders and sutures, everything he needed. Hyewon stood beside him, also scrubbed and ready. She was nervous, he could see it in her eyes, but her hands were steady. "I've only seen this in training videos," she whispered. "What do you need me to do?" "Watch and learn," Daehyun said quietly. "I'll tell you what I need as we go. For now, just keep the instruments ready and help me see what I'm doing." Benji lay on a makeshift operating table, his face pale and sweating. The debris had been moved from his leg, revealing the full extent of the wound. It was deep, running across his upper thigh. Blood still flowed steadily from it. "Benji," Daehyun said gently, "I'm going to give you something for the pain. You'll still feel some pressure, but it won't hurt. Can you hear me?" Benji nodded weakly. "Please help me. I will." Daehyun administered a local anesthetic, one of the few medications that didn't require the advanced systems. He waited a minute for it to take effect, using the time to study the wound more carefully. Instructor Velinar stood close by, her crystalline face unreadable. Tovan stood next to her, his scanner still in his hand, though it was useless now. Other students formed a circle around them, watching. "I'm starting now," Daehyun announced. He picked up the scalpel and several students gasped. He ignored them and focused completely on his patient. First, he cleaned the wound thoroughly, removing dirt and debris. His movements were careful and precise. Every action had a purpose. Then he began to explore the wound, carefully moving tissue aside to see the damage beneath. "The artery is torn," he said, speaking to both Hyewon and the watching students. "See here? This large vessel? It's carrying blood away from the heart. If we don't repair it, he'll continue to lose blood until he dies." "How can you repair it without technology?" Tovan asked, his voice full of doubt. "By sewing it closed," Daehyun said simply. He used clamps to control the bleeding, placing them carefully above and below the tear. The blood flow slowed dramatically. "A Hyewon suture, please. The fine one." She handed him the needle and thread. To the alien students, it looked like something their ancestors might have used to repair clothes. They couldn't believe this was medical equipment. Daehyun threaded the artery with small, precise stitches. Each one pulled the torn edges together. It was slow work, requiring intense concentration. His hands moved with the confidence of someone who had done this hundreds of times. "Watch his technique," Velinar said quietly to her students. "See how steady his hands are. How he knows exactly where to place each stitch. This is skill built over years of practice." When the artery was repaired, Daehyun removed the clamps carefully. Blood began to flow through the vessel again, but it didn't leak. The repair held. "Good," he said. "Now we close the deeper tissue." Layer by layer, he repaired the damage. Muscle tissue, connective tissue, working from deep to shallow. He explained each step to Hyewon, teaching her as he worked. Finally, he reached the skin and began to close it with neat, even stitches. "It looks like art," one student whispered to another. "Like he's creating something, not just fixing it." When he finished with Benji, Daehyun checked the young man's pulse and color. Both were improving. The bleeding had stopped completely. He'll need rest and monitoring, but he's stable now, Daehyun announced. The students began to murmur in amazement. Tavon looked down at his scanner, then at Benji, then at Daehyun. I can't believe that worked, he said softly. 2 more patients, Daehyun said, moving to where Myung sat. Her face was tight with pain, her broken arm cradled against her chest. This is going to hurt a little, he told her gently, but then it will feel much better. Are you ready? Myung nodded, biting her lip. Daehyun examined her arm carefully with his hands, feeling the bone through the skin. Compound fracture, he explained. The bone has broken through the skin. First, I need to clean the wound to prevent infection. Then I'll align the bone properly and immobilize it. He cleaned the small opening where the bone had pierced the skin, then gently felt along her arm, determining the position of the fracture. Hee-won, I need you to help me. Hold her arm steady here while I manipulate the bone. Working carefully, Daehyun pulled and adjusted until he felt the bone move back into alignment. Myung gasped but didn't cry out. You're very brave, he told her. Almost done. He stitched the small wound closed, then created a splint using materials from the lab. Pieces of rigid plastic, soft padding, and strips of cloth to hold it all in place. When he finished, the arm was immobilized in the correct position. How did you know the bone was aligned correctly? Velinar asked. Without imaging equipment? By feeling, Daehyun said. And by knowing anatomy. When bones are properly aligned, they fit together in a specific way. You can feel it in how they move, how they rest against each other. It takes practice, but it's reliable. He looked at the 3rd patient. Threxel, the Quelithan student, lay on his side. His breathing made a whistling sound through the crack in his crystalline skin. This would be more challenging. Instructor Velinar, Daehyun said. I need your help with this one. I don't know Quelithan anatomy well enough. Talk me through the structure of his respiratory system. Velinar moved closer, and for the first time since the emergency began, she seemed to relax slightly. Here was something she could do. Quelithans don't have lungs like humans. We have a membrane system. The crack you see has punctured one of his primary respiratory membranes. Air is leaking out instead of being processed. Can the membrane be repaired with sutures? Daehyun asked. I don't know. We've never had to try. Then we'll figure it out together, Daehyun said. He selected his finest suture, one designed for very delicate work. Tell me about the structure. Is it like skin? Like blood vessels? Something else? Velinar described the membrane structure, and Daehyun listened carefully. He studied the crack, seeing how the crystalline tissue had split. Then, working very slowly and carefully, he began to place tiny stitches along the crack. The crystalline material was unlike anything he had worked with before. It required a different technique, a lighter touch. Several times he had to stop and adjust his approach. Velinar watched closely, occasionally offering advice about the alien anatomy. It took nearly 30 minutes, but finally the crack was closed. The whistling sound stopped. Threxel's breathing became quiet and even. Daehyun sat back, exhausted. All 3 are stable. They'll need monitoring and care as they heal, but they're going to be okay. The training bay was completely silent. Every student stared at him. What they had just witnessed seemed impossible. 3 patients treated without any advanced technology, just knowledge, skill, and simple tools. Tovan was the first to speak. That was incredible. I've studied medicine for 3 years, and I couldn't have done any of that. I wouldn't have even known where to start. Instructor Velinar looked at Daehyun with new eyes. Dr. Kang, I believe I owe you an apology. What you just did wasn't primitive. It wasn't barbaric. It was medicine in its purest form. Daehyun removed his gloves and washed his hands again. It's the same medicine you practice, instructor. Just a different set of tools. The knowledge underneath is the same. The desire to heal is the same. Hee-won stood beside him, still processing everything she had just participated in. We just saved 3 lives, she said quietly. Yes, Daehyun said. We did. Around them, the alien students continued to stare in wonder. They had learned something today that wasn't in any of their textbooks. They had learned that sometimes the old ways had value. That knowledge and skill could be just as powerful as the most advanced technology, and they had learned never to underestimate the humans again. 4 hours later, the lights in the institute suddenly brightened. The normal white glow returned, replacing the dim red emergency lighting. A gentle tone sounded through the corridors. and a voice announced that main power had been restored. Daehyun had stayed with the 3 patients the entire time, monitoring their condition. All 3 were stable. Benji's bleeding had not returned. Mi-young's arm was properly immobilized. Threxel was breathing normally, the strange whistling sound gone completely. As soon as power returned, medical staff rushed in with scanning equipment. They moved around the 3 patients, running every test available. Daehyun stepped back to give them room, suddenly feeling very tired. Hee-won brought him water and made him sit down. "You've been standing for 4 hours straight," she said. "You need to rest. Are they going to be okay?" he asked, looking at the 3 patients. "The scans will tell us," Hee-won said, but she was smiling. "But I think you already know the answer." Instructor Velinar stood at the scanning station, studying the results with a look of intense concentration. She checked the data once, then twice, then a third time. Other medical staff gathered around her, pointing at the screens and speaking in low voices. Finally, Velinar walked over to where Daehyun sat. Her expression was difficult to read. "Dr. Kang, I need to show you something." She activated a holographic display showing the scan results of Benji's leg. "This is the arterial repair you performed. Do you see this?" Daehyun looked at the image. The artery showed clearly, with the repaired section visible as a slightly different color. "Yes, is something wrong?" "Wrong?" Velinar shook her head slowly. "No, nothing is wrong. In fact, it's perfect. The alignment is exact. The stitches are placed with precision that matches our best automated systems. The vessel will heal completely with minimal scarring." She pulled up another image. "This is Mi-young's bone. The alignment you achieved without any imaging equipment is accurate to within 0.5 millimeter. Some of our automated systems don't achieve that level of precision." A third image appeared. "And this is Threxel's respiratory membrane. You repaired a quilithin injury using techniques designed for human tissue, adapting on the spot. The repair is flawless. He'll make a full recovery." Velinar turned off the hologram and looked directly at Daehyun. "I dismissed your methods yesterday. I called them primitive and obsolete. I was wrong and I apologize. What you did today wasn't just competent medical care. It was exceptional." Daehyun felt relief wash over him. "Thank you, instructor. But I was just doing what I was trained to do. Any doctor from Earth could have done the same." "That's exactly my point," Velinar said quietly. "Any doctor from Earth could have done this. But no doctor trained here could have. We've become so dependent on technology that we've forgotten the fundamental skills. If this had happened on a ship, or on a remote colony or anywhere without advanced equipment, we would have been helpless." Tovan approached them, looking embarrassed. "Dr. Kang, I need to apologize too. I said manual surgery was useless. I said there was no point in learning old techniques. I was stupid and arrogant. You saved 3 lives today while I stood there with my useless scanner." "Your scanner isn't useless," Daehyun said gently. "It's an excellent tool. But tools are only as good as the person using them. And when tools fail, knowledge becomes everything." That evening, word of what had happened spread through the institute. Students gathered in the common areas, talking about the human doctor who had performed surgery with nothing but his hands and some basic tools. Some were skeptical at first, but the scan results were available for anyone to review. The evidence was undeniable. A group of students found Daehyun and Hee-won in one of the observation lounges. They came with questions, dozens of questions. How long did it take to learn manual surgery? Could these techniques work on any species? Why did humans still teach these old methods? Daehyun answered each question patiently. He explained that on Earth, doctors learned the basics first. They practiced on synthetic tissue until their hands were steady and their stitches were perfect. Only after mastering the fundamentals did they move on to advanced technology. But why? A student asked. If you have the technology, why waste time learning the old ways? For exactly what happened today, Daehyun said. Technology can fail. Equipment breaks down. Power goes out. But knowledge never fails. Once you truly understand how the body works, how tissues heal, how to recognize and treat injuries, that knowledge is always with you. No power failure can take it away. A Quilithan student spoke up. But it took you hours to treat 3 patients. With regeneration chambers, they would have been healed in minutes. That's true, Daehyun agreed. When you have the technology, use it. It's faster and often better. But what happens when you don't have it? Do you give up? Do you watch people die because you only know one way to help them? The students fell silent, thinking about this. Hee-won added, Human medical schools teach us something important. They teach us that technology should enhance our skills, not replace them. A regeneration chamber is wonderful, but understanding the body is what makes you a real doctor. Tovan, who had been listening quietly, spoke up. I want to learn. I want to learn how to do what you did today, not instead of using technology, but in addition to it. Will you teach me? Daehyun smiled. Of course. But it's not something you can learn in a day. It takes practice, patience, and lots of mistakes. I don't care how long it takes, Tovan said firmly. Today I realized I'm not really a complete doctor. I'm just someone who knows how to operate machines. I want to be more than that. Several other students nodded in agreement. They had all felt the same thing. Watching Daehyun work had shown them something they were missing. Something important. Later that night, Daehyun was called to Instructor Velinar's office. He expected maybe a formal debriefing about the day's events. Instead, he found Velinar with several other senior instructors and administrators. Dr. Kang, please sit, Velinar said. We've been discussing what happened today. More specifically, we've been discussing what almost happened. An elderly administrator, a being that looked like he was made of living wood, spoke in a deep voice. 3 students nearly died today because our staff couldn't function without technology. This is unacceptable. It's also not an isolated problem. This institute trains doctors for the entire Galactic Coalition. If we're sending doctors into the galaxy who can't function without advanced equipment, we're creating a dangerous weakness, another instructor added. What happens on a colony ship if the medical systems fail? What happens during a natural disaster that knocks out power? What happens in any situation where regeneration chambers and scanning equipment aren't available? People die, Velinar said quietly. People die because we forgot the basics. Because we thought technology made fundamental knowledge obsolete. The wooden administrator looked at Daehyun. We would like to invite you to stay at the institute. Not as a visiting physician, but as an instructor. We want you to develop a curriculum in what we're calling foundational medical techniques. We want every student who graduates from here to know how to function without technology. Daehyun was surprised. You want me to teach alien students human medical techniques? We want you to teach them universal medical techniques, Velinar corrected. The principles are the same regardless of species. Understanding anatomy, recognizing injuries, knowing how to repair damage with minimal tools. These aren't human skills. They're fundamental medical skills that somehow we've lost. Daehyun thought about his small hospital in the mountains of Korea. He thought about his teachers who had insisted he learn the old ways. He thought about the 3 young people whose lives he had saved today. I'll do it, he said, on one condition. Hyun helps me develop the program. She's a talented doctor and she learns quickly. She should be part of this. Velinar smiled. Agreed, when can you start? Tomorrow, Daehyun said. The students are already interested. We should begin while they're motivated. As Daehyun left the office, he looked out at the stars through a large window. Earth was out there somewhere, small and far away. But the knowledge that Earth had preserved, the skills that human doctors still practiced, were about to spread across the galaxy. His teachers would have been proud. He was proud too. Not because humans were better than aliens, but because when it mattered most, the old knowledge had proven its worth. Technology was wonderful, but it was the combination of technology and fundamental skill that made truly great doctors. Tomorrow, they would begin teaching that lesson to the galaxy. 3 months passed quickly. The new program that Daehyun and Hwon created had become one of the most popular courses at the institute. Every day, students gathered in the training halls to learn what they now called manual medicine. The training started simple. Students learned to hold surgical instruments properly, something many had never done before. They practiced making clean cuts on synthetic tissue. They learned to tie surgical knots, a skill that required hundreds of repetitions to master. Some students found it frustrating at first. Their hands shook. Their stitches were uneven. But slowly, with practice, they improved. Tovan was one of the most dedicated students. The confident young Quilithan, who had once dismissed manual techniques, now spent hours each day practicing. His crystalline hands were not designed for this kind of delicate work, but he adapted. He learned to use his unique physiology to his advantage, developing techniques that worked for his body structure. It's humbling, he told Daehyun one day during practice. I thought I was a skilled doctor because I could program a regeneration chamber and read scanner results. But I didn't really understand what I was doing. Now when I place each stitch by hand, I truly understand how tissue heals. I understand why the chamber does what it does. That's the point, Daehyun said. Technology should enhance your understanding, not replace it. Now when you use a regeneration chamber, you'll use it better because you know what's happening at a fundamental level. News of the program spread beyond the institute. Medical schools on other planets began to ask questions. How did the curriculum work? Could it be adapted for their own students? The Galactic Medical Council, which oversaw medical education across hundreds of worlds, took notice. Then came the test that proved the program's value. A mining colony on the outer rim sent a distress call. There had been a catastrophic explosion in one of the main tunnels. The colony's medical center had been destroyed. Dozens of miners were injured, and the colony's small medical staff was overwhelmed. They needed help immediately. The institute responded by sending a team of doctors and advanced students. Among them were Tovan and 2 other students who had completed Daehyun's training program. They loaded a shuttle with medical supplies, including both advanced equipment and basic surgical instruments. When they arrived at the colony, they found chaos. The explosion had not only destroyed the medical center, but had also damaged the colony's power systems. The advanced medical equipment they had brought was useless without sufficient power to run it. The injured miners lay in a makeshift treatment area. Burns, broken bones, deep cuts, crush injuries. The colony's doctor, an elderly being with gray skin and tired eyes, looked at the arriving team with desperate hope. "Thank goodness you're here," he said, "but I don't know how much you can do. We have no power for regeneration chambers or scanners. We've been doing what we can with basic supplies, but there are so many injured." Tovan stepped forward. 3 months ago, this situation would have terrified him. He would have been helpless without his technology. But now he felt calm and focused. "We can help them. Show us the most critical cases." For the next 6 hours, Tovan and the other trained students worked steadily. They cleaned and stitched wounds by hand. They set broken bones and created splints from available materials. They worked in the dim emergency lighting, using their knowledge and skill instead of scanners and computers. The colony's doctor watched in amazement. "Where did you learn to do this?" "I trained at one of the best medical schools in the sector, and I never learned any manual techniques. I've been trying to help these people, but I didn't really know what I was doing." "We learned from a human doctor at Taravon Institute," Tovan explained as he carefully stitched a deep laceration. "He taught us that medicine isn't just about having the right equipment. It's about understanding the body and knowing how to help with whatever resources you have." By the time additional help arrived with portable power generators, every injured miner had been stabilized. When they were finally scanned with proper equipment, the results showed that the emergency treatment had been performed perfectly. Not a single patient had been lost. When news of the mining colony rescue reached the Galactic Medical Council, there was no more debate. The program was immediately approved for implementation across the entire galaxy. Every medical school would now include training in manual medicine. The skills that had been forgotten would be remembered again. A year after the power failure at Taravon Institute, Daehyun stood at the back of a large auditorium. It was graduation day, and the hall was filled with students from dozens of different species. They all wore their graduation robes, ready to become full doctors. Instructor Velinar stood at the podium to give the graduation address. She looked out at the assembled students with pride. "Today you graduate as something new in our galaxy," she began. "You are doctors who understand both the most advanced technology and the most fundamental techniques. You can heal with regeneration chambers and nanosurgery, but you can also heal with steady hands, sharp minds, and the will to help others no matter what resources you have." She paused, looking directly at where Daehyun stood. "We almost lost something precious. We became so proud of our technology that we forgot the knowledge underneath it. We forgot that medicine is not about the tools we use, but about the understanding we carry and the commitment we make to help others." A human doctor reminded us of this truth. He showed us that progress means building on the past, not abandoning it. That advancement means adding new tools to our knowledge, not replacing knowledge with tools. The students applauded, and many of them turned to look at Daehyun. He felt embarrassed by the attention, but also proud of what they had all learned together. After the ceremony, Tovan approached Daehyun. He wore the insignia of a certified physician now, authorized to practice medicine anywhere in the galaxy. "Dr. Kang, I wanted to thank you one last time. Tovin said.
You changed my life.
You changed all of our lives. I'm a real doctor now, not just someone who operates machines. You were always a real doctor, Daehyun said. You just needed to discover all the tools you carried inside yourself. Benji and Myung, fully healed now, came over to join them. Benji still had a thin scar on his leg. He had been offered treatment to remove it completely, but he had refused. This scar is important to me, he had said. It reminds me that sometimes the old ways work just fine. Sometimes simple is best. As the celebration continued, Daehyun and Heewon stepped outside onto an observation deck. Through the transparent dome above them, they could see the stars. Somewhere out there was Earth, their home planet, still small and new to the galactic community. Do you think this will really change things? Heewon asked. Will the whole galaxy really embrace these methods? Daehyun nodded slowly. They already have. Medical schools on 100 worlds are starting programs like ours. Doctors across the galaxy are learning that technology and knowledge work best together. They're learning that you can't rely on tools alone. We did something good here, Hyewon said softly. Yes. We reminded people of something they had forgotten. That knowledge passed down through generations has value. That the basics matter. That understanding how to heal is just as important as having tools to heal with. Heewon smiled. You know what the students call you now? The human who taught the galaxy to remember. Daehyun laughed. That's a bit dramatic. Maybe, Heewon agreed. But it's also true. Humanity joined the Galactic Coalition as one of the younger, less advanced species. Everyone expected us to just learn from the older civilizations. But instead, we taught them something important. We showed them that progress isn't just about moving forward. Sometimes it's about remembering where you came from. They stood together in comfortable silence, two humans who had helped change the galaxy in a small but important way. Above them, the stars shone bright, and somewhere among them, other doctors were learning the lessons they had taught. Learning that medicine was both an art and a science. Learning that tools could fail, but knowledge never would. Learning that sometimes the simplest solution was the right one. Behind them, the celebration continued. Students laughed and talked about their futures, about the patients they would help and the lives they would save. They carried with them now both the most advanced technology in the galaxy and the most fundamental medical knowledge. They were ready for anything, and it had all started because one human doctor refused to forget what his teachers had taught him in a small hospital in the mountains of Korea, because he understood that real medicine lived in the hands and mind and heart of the healer, not just in the machines they used. The galaxy was better for it. Humanity was proving its worth not through superior weapons or technology, but through something simpler and more profound, through the wisdom to remember what others had forgotten, through the humility to value knowledge over pride, through the understanding that progress and tradition could walk hand in hand. And in the end, that was the most human thing of all.